First tonight, the families of two girls killed by a drunk driver have urged people to think twice before getting behind the wheel after drinking alcohol.
Last year, 263 people were killed on roads in the east of England. Of those, 1 in 6, that's 40 deaths, were caused by drivers who were over the drink-drive limit. The road safety charity Brake says its survey of young drivers between the age of 17 and 25 found that 1 in 8 admitted to driving after drinking alcohol. It's calling for people to avoid alcohol completely if they're going to get behind a wheel.
I don't like this numbness you feel from the shock.
Friends Michelle and Dorothy both know what it is to lose someone very close to them. What unites them further is that Michelle's sister and Dorothy's daughter were both killed by the same 20-year-old driver. Emma, Kate and Emma's sister Becky were all mown down in February, just hours after this picture was taken. Only Becky survived, badly hurt.
What happened to Kate, our future, not only mine, everybody else's was taken. You imagine when you've got a daughter, especially as beautiful as she was, the wedding. You imagine grandchildren. Your whole way of life changes. You know, I'll never be the same again. Never.
You just didn't know how to feel. You just went numb. It was like suddenly you'd been shot into a film and you were watching these events happening in front of you. You weren't part of it. You were on the outside looking in, walking around and not knowing what to do and what was real.
The girl's killer had been drinking and taking drugs before his car mounted the pavement that night in Ipswich. Today, Michelle and Dorothy were at the University of East Anglia trying to stop other young people making the same mistake. They're backing a campaign born out of those disturbing poll findings.
In the east of England, we found that 49% of young people underestimated the amount of time it takes for drink and drugs to leave your system, which suggests to us that actually more of them might be drink and drug driving than even that admit to it.
Meanwhile, a hard-hitting video is being shown to school students in Milton Keynes in an attempt to change attitudes. And a bereaved father hopes his personal account of the loss of his daughter will have its own impact.
I'll never get to walk Francesca down the aisle. I'll never get to see her children, play with her children. She wanted to eventually become a nurse, maybe go into midwifery, and she had her whole life ahead of her before it was obviously taken away so tragically.
It's a bit sort of, whoa, when you hear people who it actually happened to. Yeah, it was intense is the word I'd use.
5 of my friends died in a car accident all in one, so... And that it only happened like a year ago, so it still gets to me now.
And it's not just me as a mother or a sister, or it's friends, everybody. It wrecks everybody's lives.
Dorothy Richardson talking about her daughter Kate.
Parents are being urged to take up the government's offer of a swine flu vaccine for their children. It comes as tests are being carried out to find out whether the death of a 5-year-old boy from Milton Keynes was due to swine flu.
This is a rare glimpse of where the region's children critically ill with swine flu will be cared for. Addenbrooke's paediatric intensive care unit has 8 beds. If needed, it can be extended to 17 ventilated ones.
We do actually have all the necessary equipment on site and ready to go, and we've also already undergone extra training for nurses who used to work with us to come back into the ICU.
Today at Emberton School, a special assembly was held after one of its 5-year-old pupils died of suspected swine flu.
Unbelievably sad, complete shock and just devastating for everyone, and just my hearts just go out to his family and friends.
The 5-year-old died on Sunday morning in Milton Keynes Hospital. Today, health officials announced more tests and a post-mortem are needed before they can confirm the precise cause of death, the 13th in this region to have been linked to swine flu.
The vaccine programme is now well underway in Cambridgeshire.
Today, health officials in parts of Essex announced they'll now start vaccinating all healthy under 5s. And those in Cambridgeshire vowed to start theirs by January.
Children's immune systems are not as fully formed as adults. And when faced with an entirely new virus, as we're dealing with, they're just not able to cope.
The vaccination programme already has created extra work for GP surgeries as it comes in 2 vials and has to be mixed.
OK, just try and relax your arm as much as you can.
Dr Furtick is the latest at the Nuffield Road Medical Centre in Cambridge to have the injection. 2,500 of the 12,000 patients here are in the process of being contacted for theirs.
We think out of the 107 pregnant women registered with us at the moment, over half have been vaccinated, and we expect that number to increase.
Health officials expect up to 40% of these intensive care beds in the east to be taken up by children critically ill with swine flu. Less will be needed if parents decide to vaccinate their children. Debbie Tubby, BBC Look East, Cambridgeshire.
Still to come on Look East, calls for the government to make more people aware of the dangers of drinking during pregnancy.
A public inquiry into why the rest of the A11 should be dualled has finally started today. It's seen as the final hurdle to the plans, which are hoped to bring millions of pounds of business to the local economy.
An all too familiar sight on the A11. Every day, 24,000 vehicles squeeze through this 10-mile stretch. Plans for dualling the route have been around for decades. Finally, it really has moved a step closer.
I think it's got to be an improvement, hasn't it? It really holds people up. It's great when you go to Norwich, but from Thetford down into Mildenhall, it's a nightmare some days.
Eventually it's going to have to happen, but I'd rather sooner than later, because Mondays and Fridays you can't use the road.
It's a horrendous road to travel on. If there's ever a car accident or a broken down vehicle, you can be queuing for absolutely hours. The congestion is terrible. It's been really needing to be done for quite some time now.
The Highways Agency wants to follow the route of the present A11, apart from a loop bypassing Elvedon Village. Officials today put forward their case for the upgrade. Then it's the objectors. We caught up with Pamela Bura, who was taking the free bus to the inquiry. Tomorrow she's speaking on behalf of Barton Mills Parish Council.
Well, we very much support moving the road further from the village, bypassing the roundabout, avoiding the congestion and pollution there, and we'd have enormous environmental benefits for the village of Barton Mills.
40 minutes later and the bus still hadn't arrived. Apparently it was stuck in traffic. Rather appropriate for a road renowned for its delays. Louise Holmes, BBC Look East.
The detective who led the investigation into the Ipswich murders has been honoured today. Detective Chief Superintendent Stuart Gull received the Queen's Police Medal. He says he's a little embarrassed, very surprised and very humbled. The award is the highest honour in policing.
Almost £3 million has been spent on Colchester General Hospital to improve facilities and prevent the spread of infections. An 11-bed isolation unit has been opened for patients with MRSA, along with new beds for stroke patients.
Clarence Syson is recovering from a stroke. He's one of the first patients to make use of the new extension to the stroke unit.
Really, it's excellent. We've got shaver points in the toilets, which we've never had before. It's like a luxury hotel.
The 12 new beds here mean patients can be brought to the stroke unit more quickly, within 4 hours of being admitted to hospital.
It's a very spacious build. There's, lots of room between the beds, lots of space for doing the rehabilitation. The bathrooms are lovely. Obviously, the Trust is working towards not mixing men and women, so we're able to do that very easily in here.
It's all part of a £2.8 million investment to improve facilities, which include a new 11-bed isolation unit. Here, patients with MRSA and C. difficile can be treated away from others.
Well, I think it's very important these days with MRSA and C. diff that you have a good antibiotic policy measures, you have very good hand hygiene measures, but also half the battle is isolating people so the infections don't spread around all the other patients on the wards as well. So I think it's a very important addition to a hospital. A
strict cleaning regime and disposable curtains allow infection control, meaning cases of the bugs are being kept down.
They are decreasing, they're going down. We have got empty beds at the present time because we're struggling to find patients to come to our isolation unit.
The new facilities have opened in time for winter as demand on the hospital is expected to increase. Felicity Simper, BBC Look East, Colchester.